From the Zoomerplex in historic Liberty Village, the Zoomer, hosted by Marissa Lennox.
Welcome to the Zoomer. I'm Marissa Lennox. Well, fall is here, and that means viral illnesses are on the rise again, including COVID-19. Take a look at this graph. COVID is trending in the wrong direction. After 6 months of decline, hospitalizations have now spiked. There are now nearly 3,000 COVID patients in beds nationwide, up from 1,500 just last month. The test positivity rate is also up, now at 15.9% nationally. We're also keeping an eye on RSV, though, which hit seniors hard last year. At its worst, 180 seniors were in Ontario hospitals every day because of it. Today, we've got a team of health experts here to answer your questions about this upcoming viral respiratory season. Welcome to all of you, and thank you very much for taking the time. Before we get to some of our audience questions, I want to begin with broad strokes. As we approach this upcoming season, what kind of severity are we looking at? Dr. Vaisman, I'll begin with you.
So in terms of the COVID numbers, certainly there is a rise right now. In terms of what we experienced in the last few years, we don't anticipate that the mortality rate is going to be as bad as it was when we saw what was happening in 2020, 2021, because basically the Omicron variant is very different than the previous ones. As for flu and RSV, we anticipate that that will be worse compared to last year. We saw there's a steady increase in the numbers compared to 2021 and 2022 that we anticipate to rise now as we approach the fall and winter season.
It's interesting to hear that, Dr. Gorfinkel, because last year it was pretty severe. Many people had spoken about an immunity debt. And now Dr. Vaisman's saying it could potentially be worse.
Well, as a family doctor, you know, the best doctor on planet Earth cannot tell the difference between what a cold is, a flu is, RSV, and COVID. They all have similar sort of symptoms. So bearing that in mind, early testing is key. Vaccination is absolutely imperative, especially for older individuals, simply because as a family doctor, I have no way of knowing with certainty what it is that I'm looking at. Even when I do COVID testing in my office, the COVID test often misses it. Yeah. And that's a serious problem.
All right, well, we've got dozens of questions to get through from our audience members, and this will be a bit of a rapid fire round. So let's get to the first one. It comes from Tabitha, and here's what she writes. This is the first fall and winter virus season where vaccines are available for the 3 viruses responsible for most hospitalizations, COVID-19, RSV, and the flu. How do you expect that this will affect hospitalizations during the upcoming fall and winter season? Dr. Prezada.
So, you know, last year was quite challenging. The system was stressed like no other time. I'm hoping that the rollout of the updated COVID vaccine, the flu vaccine, hopefully the RSV vaccine, which is new and approved for seniors, will reduce those numbers because the system is just not there to handle the strain. We're already facing strains just this week. So I'm really hoping that there's good uptake of these vaccines. We have the tools to prevent a huge surge this winter.
All right, let's keep going. The next question comes from Stephen.
Hi there. My question for the panel is, what do you guys think the government's going to be doing this COVID and flu season? Are they going to be providing us with guidance, or are they going to be more so issuing mandates? Thank you.
It's an interesting question, Drew. Do you want to take this one on?
I mean, I think that the government continues to try and provide lots of information to the public so they can make really good informed decisions. I think that we're in perhaps better shape now than we were last year and able to better handle what's coming down the pipe. And so I think a lot of recommendations are going to come and be an opportunity to listen to those recommendations and act on them.
But it'll probably depend on the severity of the season, whether or not it's guidance or mandates, Dr. Vaisman.
Yes, I think the likelihood of us receiving mandates is very low at this stage, considering from the COVID perspective that we're unlikely to see as high a mortality rate as we had in the past. And from the perspective of flu and RSV, unless we see something extremely severe, it'll probably come in the form of guidelines rather than a mandate.
All right, moving right along. The next question comes from Anthony. Go ahead.
When the weather starts to get colder, it brings on a lot of flu-like symptoms. And you'd wonder, I suppose, what's the connection between cold weather, catching cold, flu-like symptoms, and COVID, you know?
What is the connection, Dr. Gorfinkel, between cold weather and catching a cold?
Yeah, this is not an old wives' tale. Science has now finally caught up with our grandmothers. In fact, cold viruses, flu viruses, COVID, is more likely to spread in weather that's cold and dry. Two things. And on top of it, our immune system is less robust. Immunity in the nose has been found to be less in cold weather than it is in warmer weather. And think about it. We're indoors more, there's more virus circulating. The amount of filtration we have is often suboptimal. People are wearing masks far less often. And think about this. Flu and cold viruses also spread by surfaces. So it's not just a matter of inhalation and aerosols like COVID is. Flu and cold viruses, including RSV, spread through surfaces as well. So think about the constellation. Get vaccinated. That's all I can say.
All right, before we throw to break, just one final question from Stephen. Go ahead.
Hi, this question is for the Zoomer panel. I've seen a lot of people wearing masks around these days. What's your advice for wearing masks, and where do you think I should wear one?
Dr. Prezada, I saw you when you came in this morning and you were wearing a mask.
So what my general rule of thumb is a crowded indoor setting where there's a lot of people who could potentially be sick is a good idea. Like we have a nice airy studio. You know, I've checked the ventilation levels are pretty good on the CO2 monitor. This is a lot less risky. So if you're in a crowded waiting room in a medical clinic, that's a super high risk setting. I would wear one. If I'm on the subway, crammed together with 50, 100 people in a car, that's a great setting as well if you want to reduce your risk of getting infected.
All right, hold that thought. We're taking a short break. When we return, Australia's flu season started early this year. What does it mean for Canada? That's next.